Dr. Amy Moore is a physical therapist, and she specializes in vestibular rehabilitation, which if you have had vertigo, you know exactly what that is, because I've had it. It's can be quite debilitating. But what makes Amy very unique in this sphere is that she creates educational content on vertigo and how to deal with it with physical therapy on social media like TikTok, which is exactly how I found her. Her TikTok page in particular is extremely popular. I think the last time I checked, you had over 75,000 followers on TikTok.
Something like that.
That's amazing. And then the other thing that sets Amy apart is vertigo can be debilitating, so she has her own company called the Dizzy PT Concierge Service, where she will come to you if you're in the Baton Rouge, Louisiana area, or if you're in other states that allow telehealth, you can actually do a teleconference with Amy and she can help you through your vertigo. So Amy Moore, this is really a pleasure. I've been wanting to bring somebody on the podcast who talks about vertigo for a long time because I've had it myself. It's not fun. Matter of fact, for a couple of years, I actually said I was just dizzy, and it wasn't until I was meeting with an ENT, she used the word vertigo. I'm like, oh, rats, I have vertigo. And so I was even using the wrong word.
There's a lot of words for it.
Hell on earth is another one.
Yes.
So, Amy, tell us, for those who are not familiar with this concept, what is vertigo?
So vertigo itself is actually just a symptom. So, similarly to if you said you had a stomach ache.
Right.
A stomach ache is not a diagnosis. It means that you have nausea or your stomach hurts. Vertigo is a sensation of spinning, rolling, or turning. So you can have that sensation for any number of reasons. There are several diagnoses associated with vertigo, including some that are life-threatening. So if you have the symptom of vertigo, you need to go to the doctor immediately to figure out why you're having the vertigo. The most common reason is the one that people think of, which is the ear crystals, the ones in your inner ears. I swear it's a real thing. But that one causes about 26% of vertigo symptoms. So the other 74% could be caused by diagnoses like Meniere's disease, which is just another disorder of the inner ear, vestibular migraine, which is a disorder of the brain, a type of migraine, or even things like the most life-threatening things is if you have a sudden onset, you could be having something like carotid artery, clot, lack of a better word, you're having lack of blood flow to the brain, or a stroke. Those can be causing vertigo symptoms. So it's really important to go to the doctor if you've never had vertigo before and you suddenly start having it.
No, it's good you brought that up because we sometimes don't take it that seriously, and I'm glad you mentioned stroke and even carotid artery disease, which could cause any number of issues. So you mentioned there are different types of vertigo?
There are. When it comes to vertigo, it's one of the 5 types of dizziness. We'll use dizziness as more of a broad category term. There's actually 5 different types of dizziness. And whenever I start listing them out to my patients, most of them know the vertigo because that's the most debilitating feeling. But dizziness itself is a sensation of movement that doesn't match the movement that is happening. For instance, feeling like you're spinning when you're sitting still, or feeling like a falling sensation when you lay back in bed, or even just feeling wobbly on your feet can be a form of dizziness. The 5 types of dizziness are vertigo, which is the sensation of turning, rolling, or spinning, lightheadedness, and visual sensitivity, which, I think most people are familiar with the lightheadedness feeling, like a sensation inside your head. Visual sensitivity is like being dizzy by moving visuals or repeating patterns, things like that. Being in a stadium and looking down in that depth and it causing you to feel a sensation of dizziness. The 3rd kind is motion sickness, which is going to be your nausea, being in a ride in the backseat of a car, that kind of dizziness. It can even cause vomiting. The 4th type is disequilibrium, which means feeling unsteady on your feet. And the 5th kind is actually called anxiety, but it's not technically the type of anxiety that we learned about before. It's more like a very specific dizziness type of anxiety. It's a fear avoidance of doing things that make you feel dizzy or fear of getting dizzy.
Interesting. So this is much more complicated than I thought it was going to be.
There's a whole TikTok page that's dedicated to all this, I swear.
I'm sure. Wow. Yeah, I've definitely had the motion sickness. I was on a ship, a boat. It was like a Bill Gilligan's Island boat in Maui one time. And forget it. It was 3 hours of torture. I was hanging off the side of the boat for 3 hours.
You can have them interchangeably, that's for sure. If you have a vestibular disorder, you're likely going to feel all 5 of them at any given time, depending on what the stimulus is that your brain is trying to interpret at any given moment.
You mentioned
a boat is a big one.
Yeah. You mentioned Meniere's disease a little while ago. Can you expand on that?
Sure. Meniere's disease is a chronic disorder, and it usually gets diagnosed as more of like a diagnosis of exclusion. If you have excluded every other possible or probable cause of the vertigo, they've ruled out all that scary stuff, they've ruled out the crystal kind, the BPPV, and they've ruled out that you don't respond well to things like migraine or anxiety medications, which are different other kinds of vertigo causing disorders. They will measure the pressure inside your inner ears, the pressure of fluid inside your inner ears. Whenever your inner ears are holding too much fluid chronically, consistently, it can affect the way the nerves work inside your inner ears. And when you have too much fluid inside of them, it will cause flare-ups of vertigo. It will also cause you to have ear fullness and hearing loss in that ear. It's usually unilateral, one-sided.
So interesting. And I ask because I'm selfish and I've been told I have Menieres, but I don't remember anyone ever measuring the pressure in my ears.
They would call it high drops in the ear. Usually the doctor can do it via audiological testing. If they sent you for testing down the hallway with an audiologist, they will measure it that way. Or sometimes they just do it by looking at your ear. If it looks like your eardrum is puffed out and you're having those consistent signs and symptoms of Meniere's disease, they can make that diagnosis at that time.
Okay. Can a head trauma cause that?
Meniere's disease, likely not. When we're talking about the inner ears, we're talking about something much deeper than you can see when you're looking inside of your ears. If you look inside of a human ear, you see an eardrum, which is just a flap of skin. And behind the eardrum, you've got an open space, which is your middle ear. But behind that is your skull bone. Inside your skull bone, encased inside of it, are these little tubes and loops, a little seashell looking thing that you think of whenever people talk about inner ears. That is your inner ear, and that gets refilled by your lymphatic system. So unlikely that something like trauma would cause it. It's more likely that something like infection in the past, ear infections, sinus infections, those are the kinds of things that lead your lymphatic system to be able to replenish and restore fluid in your inner ear correctly.
Interesting. Are there any natural ways to maybe correct that?
I'm glad you asked. Yes, not correct per se, because Meniere's is thought to be a chronic disorder that requires consistent lifestyle change. The one thing that we know for a fact will help with your lymphatic drainage inside your inner ear is having a low sodium diet. Low sodium, low caffeine tends to cause improvement in Meniere's symptoms, including the hearing loss, the ear fullness, and the dizziness and vertigo symptoms. And imbalance comes with it as well. So having your dietary changes, avoiding alcohol, things with a lot of caffeine in them like chocolate, and exercise, just plain being active, can help your lymphatic system to be more at homeostasis.
Okay. Yeah, so I'm an anomaly then because I routinely eat a low sodium diet. I do like caffeine, and the last time I had a vertigo bout was probably 3 or 4 years ago, and it was, again, a lot of crazy stuff happening 3 or 4 years ago, and I was definitely drinking a lot of Diet Coke. And I like Diet Coke, but I was drinking a lot of it back then, so maybe
Well, the ears are a really frustrating thing, and I'll tell you, it's because even if you do everything right, sometimes you will still have limitations if you've had some injuries associated with infection or injuries associated with aging even, like hearing loss. A lot of times is sensory neural hearing loss, which means the nerves in your ears have just grown dull to the sensations they're receiving, and there's not much you can do to repolish that, except for maybe put a hearing aid in and amplify the sound so that your ear nerves will pick up on the frequency better. There's not much you can do to kind of undo and reverse that damage. You have to manage it on the back end in the secondary front, which is to manage the amount of fluid going in.
Okay, interesting. The first time that I had hearing loss was one night watching television. I had the worst pain in this ear. It was like somebody stuck a knife in my ear, and it was nasty. And then the next day the ringing started.
And that's probably when the injury occurred. You probably had some kind of injury associated with infection at that time.
And that's okay. Well, and the strange thing was 3 years prior to that, I did have a head injury. So it's 3 years for this to happen. But
there are head injuries that can cause types of vertigo, but they're more mechanical in nature than, say, your Meniere's disease. Your BPPV is actually really, really common after concussions because the actual physical act of hitting your head or getting a whiplash injury of sorts where you'll have like a coup contra injury of your brain hitting this inside of your skull from being jolted. Those can cause a physical shaking loose of these inner ear crystals that are supposed to be secure. inside your inner ear, and they can be sheared off by the force. And so it's actually really common to feel severe spinning dizziness after a concussion. Those patients, it's very strongly recommended that they're checked for ear crystals, BPPV.
Even 3 years later then?
It's possible. BPPV is thought to be transient.
Okay.
Your ear crystals kind of are known to slough off a little as we get older, especially, and with injuries as we move. However, they are meant to kind of dissolve. We're kind of like complex creatures, humans. They're kind of meant to dissolve on their own with head movements, and they're usually dissolved within about 3 weeks of the injury, depending on how much you moved your head and the inner ear pressure itself, how much fluid is moving in there, how much they get washed over, basically, and how big the crystals themselves are. Kind of will make that timeline. But usually it doesn't last more than 3 weeks. But that being said, I've had patients that say, every time I roll on my right side, I feel spinning, and I have felt that for 5 years. And I say, well, if it was 5 years, it can't be ear crystals, you know? But then I check them, and it's plain as day positive.
Wow.
So I don't know. I wasn't here 5 years ago to check it, but I have theories.
Yeah, and you, Neil, you use the same phrase I always do. We're complicated creatures.
Yes, we are.
We really are. And you've mentioned BPPV, and that's one I've heard in the past. Yeah, can you expand on that for those of us who have never heard of that phrase before?
Well, BPPV is kind of similar to Meniere's disease in that it is a diagnosis that afflicts the inner ear. BPPV actually stands for benign paroxysmal positional vertigo, and it's the most common cause of vertigo symptoms. It is a mechanical shaking loose of objects that are inside your inner ear. Remember, these are not open to the outside world. They're encased inside your skull. So if these shear off from their membrane, where you have about 100,000 in each ear at birth, and they're meant to weigh down this membrane full of nerve endings to help you feel the motion of that membrane with the fluid. Your inner ears are your motion sensors. That's their job. So whenever these get sheared off or crumbled off and go tumbling inside your semicircular canals, which help detect angular acceleration of the head, movement of the head, you will now get these crystals tumbling around in there where before there was only fluid, lymphatic fluid. It's called endolymph inside the inner ear, but it's really just lymphatic fluid. And these crystals will displace fluid at a higher rate than your brain is used to detecting. So you've got one ear who's acting completely normal, and you've got one ear that has crystals inside of it. You go to lay down, the crystals tumble backward in this ear only. It will send a signal, a red hot signal in this ear that you're falling backwards and spinning. And this one says we're still. So your brain's like, I don't know what to feel right now. But it causes severe spinning sensations, especially with position changes. Anytime the crystals move, you will feel dizziness. It will cause something called nystagmus, which means repeating eye movements. If you've ever been on a merry-go-round and then stopped suddenly and your eyes were doing this, that's because the fluid in your inner ear canals were still moving, your semicircular canals. It'll cause that to happen whenever you just rolled over in bed.
Been there, know exactly what you're talking about.
It's horrible, and it's sudden. And they say if you have it, you know it.
It is incapacitating.
Yes.
Yeah.
It makes you feel like you don't know where the ground is and where you are in space at all. I've had patients who can walk around with it, and I've had patients that can't even move at all. They need to be wheeled into the clinic. It just depends on the person. It depends on the size of the crystals that have broken loose. Depends on how sensitive they are. I generally tell my patients, if you throw up on carnival rides, you're going to throw up on this carnival ride. I think it just depends on the human.
Yeah. When it first hit me, I remember laying in bed for about a day. Couldn't move, lay on my back, couldn't move. And again, like you said, turning on your side, everything is when you think it's getting better. My goodness, the bed is flip-flopping, and it's
horrendous.
It is horrendous. And that leads into when I first started investigating this and how to maybe get rid of this positional vertigo, the first thing I encountered was something called the Epley maneuver. Can you explain to people, and I know you even have, that's how I found you, the TikTok algorithm showed me your Epley maneuver video, which I thought was phenomenal.
Thank you.
Best Epley maneuver video I've seen, and I've looked at many of them. So can you explain to people how the Epley maneuver works and what it is?
Well, it's a very mechanical style treatment. And the Epley maneuver, I want to kind of zoom out for a second and just point out that it's one of many canalith repositioning maneuvers. Canalith means debris, and reposition means to move the debris. There are actually around 50 maneuvers of the inner ear semicircular canals and ways for us to target different canals. There's 3 canals in the right ear and 3 canals in the left ear. because of their anatomical orientation, in each ear there's one canal that's shaped kind of like a hoop earring, or the pipe, the drain pipe underneath your sink, that little catch pipe. Because when we stand upright, it's in that position. When things tend to tumble and crumble and fall, they tend to get trapped in there. It's like a little trap. So the Epley maneuver treats that specific canal, which usually is about 98% of BPPV cases. The other 2% cases are in the other canals and would require other maneuvers. And there are other maneuvers that a professional can help you with, but it is rather safe, regardless of where the debris is, to attempt an Epley maneuver at home, which is why I put it out an instructional video myself. The Epley maneuver is basically, and any other maneuver, positioning the head in such a way that you're kind of tipping your inner ear canal in such a way that the crystals will tumble and settle into one spot. I actually have right here my little ear.
Nice.
Ear canal thing, and this is what I use in my videos. This is actually, I use a lot of movie magic in my videos to be able to show these kinds of things really clearly and to make them tumble quickly. So I probably won't be able to demonstrate it as accurately with this today, but think if the debris was right here, you tip your head in a position such that you let the debris fall to the bottom and you wait for it to fall. That's why the waiting phase is important. In each position that you change, you have to wait until the vertigo stops and give it a few more seconds, because while these are moving, you're going to feel vertigo. When they stop, you'll stop feeling the symptoms. But each position is designed to make the crystals move a little bit further down the tube. And now this looks like a weird like 3D model because it's inside your skull, but it really comes down to basically 3 different motions. You have to turn your head and lay back, leave it there tipped back, then turn your head the other way, leave it there tipped back, then roll on your side and turn your nose down in the bed. And those are the 3 motions that will clear out and force fluid backward in that canal. And if there's debris inside the fluid, it will continuously keep moving it towards the main sac. That would be this area right here. That's where the membrane resides, and it's designed to absorb them whenever they come back to it. So you should be able to move freely after an Epley maneuver if it's successful.
Successful. And I've seen some people online who would talk about this, say there's a right and a left Epley maneuver, whether you're turning your head to the left or right. How do you know which one is right for you?
Well, a good place to always start if you're not feeling confident is the doctor. The right Epley maneuver treats the right ear, and the left Epley maneuver treats the left ear. So if you're unsure about which Epley maneuver to attempt, there is a test you can perform at home. I'm about to tell you about it a little bit. But you can also go to the doctor. If you're not feeling super confident, the doctors, primary care doctors, neurologists, ENTs, and physical therapists know how to perform this test. It's a test called the Dix-Hall-Pike test, named by 2 guys named Dix-Hall-Pike who discovered it. Basically, you're putting that inner ear canal in a dependent position such that if there's debris in it, it will tumble quickly and aggressively. So it will bring on the sensation of vertigo if you have BPPV. You turn your head about halfway to one side, you lay back and tip your head backward over the top of a pillow. So the pillow's kind of behind your back. And you just lay there. If you turn your head to the right, you're testing your right ear. If you turn your head to the left, you're testing your left ear. In the 20 seconds after you lay back, you're waiting for crystals to tumble. If they're in there, they're going to tumble in that position. If they start to move, you will feel a sensation of vertigo within 5 to 10 seconds of laying back. That sensation of vertigo will last 10 to 30 seconds and then stop, because that's how long it takes for them to crumble and move. And you will have something called nystagmus, which is the repeating eye movements. With the Dix-Hall-Pike, you're just looking for this kind of motion of the eyeballs. Both of them will do the same thing. If you're the person who's feeling it, if you open your eyes, it will look like the room is doing that. If there's a person external to you, they will see your eyes do it. It looks very alien-like. But that indicates that you have a positive test. So if you turned your head to the left and laid back and waited and got that sensation, it's positive for left-sided BPPV, and you can go ahead with the left Epley maneuver.
Okay. I know, I remember a doctor doing that very test to me. I didn't know the name of it, but I do remember when the doctor did it to me, I didn't have vertigo from it. I,
I will say there's a lot of doctors who are unconfident, and I wanted to ask you about your experience with BPPV because I hear a lot of horror stories from my patients. I mean, not to sugarcoat it, that they felt vertigo. They went to the doctor. The doctor was like, "You got vertigo? Like, that's not even a diagnosis. That's a symptom." So
yeah, I'm not.
a lot of my patients will say the doctor didn't do anything like you're doing to me, and they just sent me home with, meclizine, which is a medication that makes you not feel it, but it doesn't actually do anything to help cure it any more quickly. Just makes you not feel the sensation temporarily.
I was unimpressed with meclizine. I've tried it and it's over the counter, so I used it and I don't think it did anything for me, to be honest with you. My doctor did prescribe me a round of prednisone. That was one of the first things he did.
That's helpful.
And I always tell people, I love prednisone. I mean, you feel really good on prednisone.
Mhm.
Nothing hurts. You feel great. The side effects long
Mhm.
term, not the greatest. It didn't do anything for me other than make me feel good for a week or so.
With BPPV, it's a mechanical problem. So if
Yeah,
you didn't resolve the mechanical problem,
right.
as opposed to something like an ear infection causing like a vestibular neuritis, which is just inflammation of the inner ear nerve.
Mm.
Steroids would do a huge amount to resolve that. And that's why it's really important to figure out what's causing your symptom of dizziness because it's treated a lot differently. An Epley maneuver will not help you if you have Meniere's disease. It will not help you if you have PPPD or vestibular migraine. You have to have something mechanical to clear out in order for the mechanical clearing to be the resolution.
So this is interesting. And also later on, I was prescribed a water pill, HTZ, yeah, and it didn't do anything either, which I didn't think it would because I eat a low sodium diet anyway. But
Mhm.
you said something interesting. So Epley won't help you if you have Meniere's disease. You
Absolutely
just
not.
told me something that I was not aware of because I've been told repeatedly I have Meniere's because I have ringing in this ear, I have hearing loss, and I've also periodically had some bouts of vertigo, which they all said you got Meniere's, but you're saying no.
Correct. So here's the really weird thing about Meniere's disease. Because the inner ear is constantly in waves of being inflamed, the vertigo that you're feeling could just be that you're having a lot of fluid inside the inner ear, a high pressure situation in your inner ear at that moment. It could also be that the high pressure situation in your ear has caused BPPV. There are many clients that I have who have something underlying like vestibular migraine or Meniere's disease, and they have overlying recurring bouts of BPPV as well. But the really important thing to take away is that if you have Meniere's disease, you don't know if your vertigo symptoms or your vertigo flare up is coming from your Meniere's itself or from BPPV unless you test yourself for BPPV. If you test yourself for BPPV or get tested for BPPV and test positively, then an Epley maneuver will help because you have an overlying condition on top of what your disease process in your ear is already doing.
And the test would be that one that Dix,
Dix-Hall-Pike.
and
Yep.
and it did not trigger vertigo in me when I had it done the last time.
hmm
So I
Some
may,
people have a theory that moving fluid in the inner ear can help with like flowing. There's kind of a theory that the inner ear canal has a valve that connects the rest of the lymphatic system with the inner ear itself to allow more fluid in, and that valve has been burst or injured in some way by a disease process for Meniere's disease, which causes an unregulated amount of fluid to be in it at any given time. So if your fluid is low or high, it will cause you to have more symptoms. So, I mean, some people suggest that if you have somebody with Meniere's disease and you have them do a maneuver that flows fluid, even if you're not getting debris out, it could help. But in my experience, it really just flares them up.
okay. And Epley did help me. I felt it did because I did it on my own. Just
Yeah.
looking at videos. I'm like, let me just try this.
Next time, test yourself. And it's plausible that just getting your lymphatic fluid moving could be a form of lymphatic drainage to help with that pressure in your ear as well.
Interesting.
Maybe you should do a study on it.
I got to tell you, I'm a little afraid to exacerbate it and try to do it on myself because
A
again,
lot of people
anybody,
feel that way.
it's traumatic. You cannot stand up. And at first I had no idea. It's like you're drunk and you're not. And I don't drink alcohol, which
Yes.
which which leads me to another question is ironically, I have a buddy who just got vertigo a week ago and he said, well, I came home from hockey and I had a few glasses of wine, maybe more than he should have. And he woke up the next day saying for like 2 days, he was kind of, woozy with vertigo. So can alcohol trigger this?
It can. Your state of hydration can definitely trigger it. Your inner ear health overall can trigger it. If you have some kind of sinus infection or ear infection, that is the most common cause of BPPV. Also trauma, being in a car accident where your head has been in some kind of whiplash position, or a fall where you hit your head. I recently had a concussion client who had BPPV. Her husband accidentally pulled the back hatch of the vehicle down and hit her head. He was really sorry. Really, really sorry.
Yeah.
He felt bad. Those are all common causes of BPPV. And of course, there's the most frustrating ones, which is genetics. Some people just have more brittle crystals than others and thinner membranes that hold them on than other people. And idiopathic causes. Idiopathic, which means it's a fancy medical term for we don't know.
We're idiots. Yeah.
Yes, idiopathic.
Yeah.
You can extrapolate what you want by the idio.
Yeah. Well, I'll assume that it is stemmed from a head injury I had 3 years prior to initially getting this. And it's strange because I remember my hearing loss was getting better there for a while. And then it seemed to have gotten worse. So very odd, but.
It's hard to say. And hearing loss, I'm not an audiologist. I will qualify that with this. But when it comes to hearing loss, the most common thing that causes hearing loss is exposure to loud noise over time in your lifetime. And that causes those little hair cells that are supposed to detect the vibrations of your cochlea to break over time and crumble over time and to be less sensitive overall. So it's one of those like tough to swallow things for a lot of clients, that they suddenly got hearing loss from an infection or from just over time they've noticed they've gotten deaf, and it's frustrating to not be able to do anything to quote unquote fix it. But there are a lot of things that you can do to implement in your lifestyle to help you hear better and function better.
Exercise, maintaining hydration, not abusing alcohol. What about smoking and vaping?
Smoking and vaping, they're both known to cause, well, not vaping per se. I won't say that for sure because I'm not positive, but smoking definitely causes the distal capillaries, the capillaries on the very outer portions of every part of your body, to start having more clots, more difficulty with blood flow. And anytime you have that, you're going to start having nerve loss. It's a very common cause of distal nerve loss, and that does include the inner ear nerves that have to do with your balance, your sensation of where you are in space, and your hearing as well.
Par for the course, there's nothing good that comes from smoking.
Yes, correct.
When somebody is experiencing a bout of BPPV, I always butcher that for acronym.
You did good.
Yeah, thanks. You can sometimes feel it coming on. I had this conversation with my buddy the other day. He said, do you feel it coming on sometimes? And there are times when I feel, yes, I'm on the precipice, and it doesn't happen, thank God. But when it does happen, when you do have this bout of vertigo, what are some things you should immediately do to help yourself, if you can indeed help yourself?
Good question. So first, I want to start with what symptoms you're looking for that might indicate that you might have BPPV, that you might be thinking along those lines. And that's the same thing we look for as clinicians. And that is a sudden onset of severe spinning vertigo. 1 second you were fine, and the next you were not. Right. And it usually comes on with a head movement, like rolling over in bed, sitting up in bed. I hear a lot of, I was in Pilates laying back and I went to sit up and then I suddenly felt spinning. Then after that moment, a large transitional head movement where you move your head against gravity will trigger it every time consistently. That is a sign that is BPPV that's causing it. See, I butchered it. That's BPPV. Say that 5 times fast. If you have something like that triggering you, first of all, I will go back to what I said at the beginning. If you've never felt anything like this before, it's really important that you immediately go to the doctor. And I would say urgent care is probably more appropriate unless you're having other signs and symptoms of, say, like a stroke. Right. If you're having like weakness on one side, other symptoms, then go to the ER. But you can go to urgent care if you've never felt it before, or your primary if you can get in same day if you're feeling just what I described. Right. If you have had it before several times and you're like, I'm just tired of this, and you felt it and the doctor's fixed it for you before and you're kind of familiar with what you have, I would recommend definitely checking yourself, testing yourself with the Dix-Hall-Pike test. And I do have several videos on my YouTube, my TikTok, Instagram, and Facebook regarding that. And it's the test I described, turning your head and laying back and waiting to see what happens on each side to determine if it is BPPV, and if so, which ear. If you feel those clear and concise symptoms that I described earlier, and you detect which ear, you can attempt an Epley maneuver at home. Usually that resolves most cases.
Is it?
If you can pull it off.
Yeah, yeah. Is when doing the Epley, is it correct to say if the room is spinning to the left, you should turn your head to the left and vice versa for right?
I'm glad you asked that because that's a really common misconception. It's not always that simple because if the crystals, if you roll this way and you make the crystals float up the tube, you're going to feel a different sensation than if you roll the other way and they flow down the tube. It will make you feel opposite. So that doesn't necessarily tell you which ear it is. So just saying every time I roll on my left side, I feel it, or every time I feel it, I feel like I'm spinning to the left, doesn't necessarily indicate that it is your left ear. It's good evidence that it's likely your left ear, but it's not a foolproof method. Your best method is to test yourself and identify which ear that way.
Test yourself with that dig. Yeah, the other test that I can't pronounce. The digs.
Dix,
Yeah.
D-I-X.
Yeah.
Dix-Hall-Pike.
Thank you. I've also heard that when people say you do an Epley maneuver, you have to keep your head upright for like 24 hours.
I'm glad you brought that up too. Another common misconception.
Thank you, because I tried that once. It's hard. I mean, I gave it a good try until about 3 o'clock in the morning. I said, screw it, I'm going to
Oh
bed.
no, it's just torture for you, and it's for no good reason too. Let me tell you why the misconception came about. Because if you get the crystals to flow here, then here, then here, and then you sit back up, this is about the position it will be in. If they fall into the main sac, you've got a fluid-filled sac with a membrane at the bottom, right? And think of it as like a pitcher of water with a sticky bottom. You're trying to get these little beads to set into that sticky part, right? So the theory is if you go to tip that pitcher, they may crumble off of it and go right back out of the pitcher, right? Actually, we've proven over and over and over and over again in research that making a patient stay upright all night long, wear a neck brace, sleep in an easy chair makes absolutely no difference in the success of the maneuver. More likely, as soon as they touch the membrane, after you sit up, it takes a few seconds for them to waft to the bottom and hit the membrane. It only takes a few seconds for them to be stuck and to stay stuck. And honestly, if they don't stay stuck within the next hour or so, they're going to come undone again. So we have to redo it and put them in a different spot anyway. So you might as well catch it now and retest. I always retest my patients and do at least 2 Epleys to make sure that we flowed all the fluid in the right direction in one session and try to get it in one session.
Okay. All right. I'm glad you said that because it's very difficult to do.
Yes.
Like I said, at 3 o'clock in the morning, I threw in the towel and I said, I got to go to bed.
Good. I tell my patients, I want you to go home and lay down. Keep your head upright for about an hour. Yeah. Keep the top of your head facing the ceiling. And then after that, I want you to start moving. Bend over and tie your shoes. Lay down, sit up, roll over, lay on both sides. Make sure it doesn't come back. Because if it does, it means we need to be redoing it and getting them sitting on a different spot so that the membrane can absorb them a little more securely. There's been tons and tons of studies out there with, I mean, I can't quote an exact number, but thousands of people who've been studied who've had BPPV have been told to sleep upright versus people who've had it treated and were told to just do whatever they want. And there's no difference in the outcomes in those two groups.
That's good news.
Yes.
For those who have gone through physical therapy for their BPPV, do they have to do ongoing physical therapy to maintain their non-vertigo status, or is
Such great questions, Joe. I love it. Sometimes some people do and some people don't. And what I always do is leave it open. In physical therapy, we always have to order blank times a week for blank weeks, right? And with a person who has shoulder replacement surgery or a balance issue, I can easily define how many times a week they need to come to therapy and how many weeks they're going to need therapy to get where they want to go. But when it comes to BPPV, some people, if you get it out quickly, feel immediately back to their normal selves. Other people struggle a little bit. They need more maneuvers because they're still having consistent recurring symptoms that's continuously getting unstuck again, or we didn't get all of the debris out the first time. They need to go home and lay down and roll around to feel that, you know? There are also people that their ear remains inflamed after going through such a thing, and they're having a lot of trouble with their brain, their eyes, their balance system in their inner ears all coming together again to work in harmony after such a large event. And it just depends on the person, and it depends on their response, and each case is different. So I always say PRN, which means as needed frequency, for 30 days. And I tell my patients, I always do a follow-up to make sure that they've had a few good nights, they haven't felt the vertigo, I retest them, make sure it's still negative, and then I say, I'll just keep you on hold if you have a problem, follow up. Some of them still do on day 2 and need some follow-up exercises, vestibular rehab exercises to continuously make those systems work together. Some people need more maneuvers. So I always try to leave it open.
Okay, very good. When I started having this, I went on a quest and I experimented with many dietary supplements. I actually wrote about it on my website, my quest to find a cure. And I did not find a cure. I tried everything from...
I wish we could find one, Joe.
Yeah. And the only supplement that people ask me about is the one that I've seen advertised on television called Lipoflavoid. Have you heard of that?
Studies are conflicting on the lipoflavoid, and that is more for hearing loss, or is suggested to be for hearing loss, than per se the vertigo. I guess it's more of a general ear health, but there was a company that approached me, I won't name them, but they wanted me to advertise on my TikTok channel the lipoflavoid, and I just can't advertise something that's not proven by research and suggest it to people to spend money on. That's not to say that it hasn't helped anyone or that all studies are negative. It's just that it's too conflicting for me to say for sure. But there is one thing that for sure helps with BPPV, and that is D3, vitamin D3, if your vitamin D is low. And that is because if you have low vitamin D, and that's going to be your typical osteoporosis patients, you're going to have issues with your bones breaking down over time. Your inner ear crystals, they're also known as otoconia scientifically. They're made of similar substances as your bone. So if you have osteoporosis, osteoporotic changes in your bones, that's going to be your more postmenopausal women category more than anybody. If your vitamin D is low and you restore it, you will have less recurrences of BPPV, and we have seen that in studies.
I think I did a video on that on my YouTube channel. You just brought it back it was a couple years ago. Yeah, the lipoflavonoid, when I looked into it, I saw some studies from the 1960s. And what surprised me is here we are decades later, and I haven't seen any newer research on lipoflavonoids.
Maybe there should be more new research. It's really an understudied area, the inner ear itself, and it's frustrating because it's something that affects people's daily lives, you know?
Right, and I don't know why the company doesn't do any research on it. So they're not going to ask me to,
maybe they don't want more negative results.
Yeah, they're not going to ask me to promote their product. I mean, and it's funny because when I tried it at first, I thought for the first day I'm cured, and then the next day, forget it. My hearing loss went away. So
it's worth a try. It's not harmful, I don't think. There's nothing to show that there's any harm in trying any supplements as long as you don't overdo it.
Yeah,
I think they're all safely available across the market, and if it helps you, go for it. That's what I say.
I agree. And lipoflavonoid, it's an extract of lemons, lemon bioflavonoid, so there's no problem with that with anybody. So, what advice would you give someone who feels frustrated and anxious? This came from somebody I know who had it, and again, thinking, when is it going to hit again? And I've experienced that. When is it? I mean, it's always in the back of my mind, I have to tell you, especially if I go to the gym and I'm doing like a flat bench press on the gym, I'm thinking, what do you do if it comes back?
It's a really frustrating thing, and I always treat that with information. Knowledge is power, and I know that doesn't solve everything, but if you can identify your triggers, if you can identify how to test yourself and have that tool in your tool belt of how to test yourself and treat yourself as quickly as possible if you have BPPV, if that's your cause of your problem, that is a good way to execute, I need to be able to move my head. It's not realistic to think I'll never lay down again, or I'll never lay on my right side or lay flat again. You have to move your head. In fact, research shows that moving your head more freely and more frequently is actually something that will reduce your recurrence rate. So you have to kind of wrap your brain around the fact that if it's going to happen, it's going to happen. You have to move your head to reduce the recurrence rate, and you have some tools in your back pocket to help you deal with it when it does happen. When it comes to other diagnoses like vestibular migraine or Meniere's disease, learning more about what's the cause of yours can help you to minimize triggers. Like for Meniere's disease, it would be your caffeine, your alcohol consumption, your sodium intake. For vestibular migraine, it might be flashing lights or driving at night. There are things that you can help do and keep in your toolkit to help manage whenever you do have a crisis situation and to mitigate how much you're exposed to that causes a crisis situation. So I think the biggest thing is going to your doctor and your physical therapist and figuring out what those things are, what makes your vertigo tick.
Yeah. One of the things that I saw recently that I thought that's a great innovation is there are now cars that have the technology that if they think you're in trouble, they will pull over to the side of the road and
Very cool.
ostensibly also call 911 or whatever, roadside assistance. And I thought that was great. And again, it's always in the back of my mind. So that's what I was thinking. What's the worst case scenario? And if, it's really cool that AI technology is there to help people.
Very cool. When it comes to driving in vertigo, I will say the only kind that you really can't drive with because you don't know when it's going to happen is BPPV. And generally, you have it before you get behind the wheel of a car. It's likely that you're not making a gravity changing head movement while you're driving. It very rarely happens whenever you're driving. And if you have something like Meniere's flare-ups that causes vertigo, you kind of already knew before you got in the car and you would decide not to drive. So there's very rare situations where we recommend that you can't drive with vertigo. Yeah. You just don't drive when you're feeling dizzy. We don't take your driver's license away. We make recommendations.
I'm sure you do. Yeah, it's not good to drive when you can't stand up.
Mm-hmm. I think you kind of know when you can't,
Yeah. Are there any misconceptions that people tell you about or you've encountered over the years about vertigo or BPPV?
Tons. The most ever. My whole channel, I did a whole series on myth busting for BPPV. And the biggest myth is that an Epley maneuver fixes all vertigo, or that just watching an Epley video on the internet will solve everything because, did you watch a right one or a left one?
Right.
And why are you doing the maneuver? So that's the biggest misconception we see. The second misconception is that vertigo is a diagnosis. If you go to the doctor and they diagnose you with vertigo, that's probably going to be a really old school doctor or a doctor who doesn't want to misdiagnose you, miscode you right early on in your journey and is trying to send you to the appropriate avenue like an ENT to get further diagnostic tests done so you can get a proper diagnosis. Because a proper diagnosis would be like PPPD, Meniere's disease, BPPV. Those are all real diseases that cause these symptoms. Vertigo is a symptom itself, so you can't diagnose somebody with vertigo per se.
That's a good point. Vertigo is a symptom.
Yes.
I like that.
You could have vertigo from a stroke, or you could have vertigo from ear crystals,
Yeah. Okay. That's a good way of looking at it because, and again, when people have said I have Meniere's disease, I always cringe at that word. I'm like, disease. I never liked that because I'm like, cancer is a disease. I just don't stand up periodically. And again, fortunately, it hasn't happened in many years, but again, I never liked that. So I'm encouraged the fact that I may or may not have Meniere's.
It's kind of a trash can diagnosis, for lack of a better term.
Okay.
It's one of those, whenever we can't figure out why you're dizzy, we give you the Meniere's diagnosis. But I will tell you there's 4 main characteristics, and you have all 4 of them. So you have the ear fullness, you have the ear ringing, you have the hearing loss, and you have the vertigo spells. Those are the 4 magic combos that gets you diagnosed with Meniere's disease, unfortunately.
Okay, well, I got it then. All right, I was hopeful for a moment.
It's possible that you have other things going on in addition to it as well, though.
Oh, I got some things going on, but
like BPPV, recurring bouts of BPPV could be happening on top of it.
Yeah, most definitely. And again, fortunately, knock on wood, I haven't had it in several years, so I'm encouraged that maybe I'll never get it again. But yeah, I'm an anomaly. But I would trace mine back to a head injury, and it does make sense. I was talking to I think it was ENT a couple months ago, and he said maybe apparently the strongest bone in the body is in the ear.
Mm-hmm.
And
the temporal bone.
What is it called again?
The temporal bone, unless he was talking about the little floating bones on the inside, the stapes, the incus, and the malleus.
I think that's it. He said, maybe you fractured it. I'm like, yeah, I fractured the strongest bone in my body. Okay.
That floats inside your middle ear.
Yeah.
I doubt it.
I don't know. He suggested getting another MRI. I had an MRI like 10 years ago. It didn't show anything. So I'm like, should I get another one? Is it going to tell me anything different? He was just like,
They'll tell you if it's changed.
Yeah.
But, you can think of the human head as like a helmet that if you experience trauma on one spot, it ricochets throughout the entire thing.
Yeah.
And there's a lot of little holes where little nerves have to pass, including your cranial nerves. Your cranial nerves, 8, is the ones that go to your inner ears. And your inner ears themselves are literal tunnels inside your skull. So you've jolted the whole thing. It's plausible that you may have caused some inflammation and some damage with a head injury. It's very plausible.
Yeah. Interesting. No one ever
Yes.
prescribed me an antibiotic though if I had an infection, which I always felt was very weird. I never got that, but it is what it is. Um,
Mhm.
is there anything on the horizon that's on your radar that you're like, that's really interesting? That actually might make a difference in the lives of people who have either vertigo or hearing loss or anything like that.
When it comes to vertigo and hearing loss, unfortunately, there's not a lot of new things out there. There are a lot of balance activities. Vestibular rehab is becoming extremely more popular with this age group, not age group, with this exact population of clients.
Right.
The problem is convincing the doctors to send the clients to your therapy, and convincing the clients that we can do therapy to help with vertigo, and it does tend to help. When it comes to BPPV and vertigo, there's a lot of gimmicky things out there that you have to be afraid of, unfortunately, more than things that are hopeful. For instance, the Zook device, it's like a little ear plunger type thing. It's got a bulb and it's got a long stem and like an earplug, and you stick it in your ear and it suctions your eardrum. Well, as we've discussed with your inner ear anatomy, that doesn't affect your inner ear in any way. It would not reduce migraines. The only thing it does is tug on your eardrum, and in some cases it's even ruptured people's eardrums. So it's not something that would work. Same thing with these big chairs that they strap you into that flip you upside down. If you picture a floating head, laying back and tipping it off the edge of a bed does the same thing. So why are we buying a $100,000 chair to scare you with? So there's a lot of gimmicky things, unfortunately, but not a whole lot in the way of promising new things that can
Okay.
help.
All right. Same thing with the people I see on TikTok and elsewhere where they have you tugging on your ear and
Yeah, not really. It doesn't really affect it that way. I would say the most promising thing is all the improvements we've made to vestibular rehab, and how many vestibular rehabilitation therapists have really grown a strong practice with thorough protocols for each thing. I think that's where the really exciting thing is for me.
yeah,
It just seems a little less flashy from you guys' end.
I got you. Is it
Yeah.
challenging to get doctors to refer to you?
Yes, it is. We often get clients like you who've suffered with it, struggled with it, and they'll go to the doctor and say, "What can I do?" And the doctor says, "Nothing. Go home and suffer." And if I call and say, I've even had clients that have reached out to me from my TikTok page, and they said, "My doctor said there's nothing I can do." And I say, "Well, we can try vestibular rehab." And I send the order to the doctor, and the doctor won't sign it because they just say, "You're just going to put them through a bunch of nonsense and it's not going to work." And I say, like, "Well, have you tried?" Because I've done this a million times with a million patients. That's an exaggeration. I've seen hundreds, if not thousands, of patients and got most of them better, a high percentage better. So let them try. It's better than just sending them home and saying there's nothing you can do.
I'm assuming that there are meta-analysis out there of vestibular therapy that doctors would be aware
It's
of.
coming. Vestibular rehab is really something that has only become mainstream in the last 30 years or so. And it's really become much more niche in those 30 years. So they thought it was just to do Epley maneuvers, to do cannula through positioning for BPPV only. Now it's really expanded to help people manage lifestyle habits for Meniere's disease, for vestibular migraine, for PPPD. It's more exposure therapy and anxiety mitigation. It just depends on the diagnosis,
Yeah.
but there are huge protocols out there that just don't have the longevity to have a huge amount of studies behind them yet, but they're promising, very promising.
It definitely helped me. I went through some physical therapy for a few weeks, and knock on wood, I haven't had a bout in I don't know 4 or 5 years, maybe.
Most of
So
the time we can resolve it fully, and if we can't resolve it fully, we can at least help you identify triggers
yeah,
and manage it through lifestyle changes to help you
right,
get your vestibular system as strong as it can be going into it,
yeah,
and mitigate all the external factors so that you have fewer and fewer recurrences.
very cool. If somebody was looking to reach out to you for doing remote vestibular therapy, is this through all 50 states in the union, or some, or
Unfortunately, it's not. And it depends on the state laws. Each individual state has its own laws regarding what type of physical therapy license they will allow to practice in their state. And so it really comes down to if they allow out of state therapists to practice on their residence. And there are 32 states in the United States that will allow out of state therapists to practice remotely or to come into their state and practice. I have to get licensed in that state first. At this moment, I'm licensed in 10 states. My home state is Louisiana. That's where my home license is. I can see patients in person if it's in the Baton Rouge area. Otherwise, it's telehealth. And if I can't accomplish everything I would do in person via telehealth, it's my responsibility as a clinician to say you should go somewhere in person. But if you live in one of the states where I can't work, or if I can't do the telehealth as effectively as I would in person, I recommend going to VITA's website, the Vestibular Disorders Association. They're a huge resource for dizzy patients. If they go to vestibular.org, you can search your zip code or your location anywhere in the world.
Okay.
And there are vestibular therapists just like me everywhere. You'd be surprised.
I'm writing that down right now. I'm going to put that in.
Vestibular.org. And if you want to give them a specific link, vestibular.org/directory.
Okay.
It's a directory of, I would say, most of the vestibular specialists in the world.
All right, I'm going to write that down. I will put that in the show notes for people who are interested. Amy, what's the best way for people to reach out to you personally if they want to have you help them?
Well, I would say there's going to my website. It's really hard to keep up with all the comments when you have 75,000 and even the DMs. But I think the serious inquiries only will click on the link in my bio. I'm on Instagram, Facebook, TikTok, and YouTube.
Okay.
If you go to the link in my bio, it will bring you to my link tree where you can submit an inquiry. The only way I can really help, I'm going to say, like, you can hire me to help you, would be if I do physical therapy on you, though. I can't practice outside of those realms. I'm not qualified to, say, just give psychological advice and not give you physical therapy advice. It kind of crosses over. So it has to be a place where I'm licensed to practice physical therapy.
Okay. I'm going to link to all that in the show notes so people can reach out to you personally. Who
Sure.
knows? Maybe you can help somebody who's listening to us right now who's been struggling with vertigo and didn't even know what it was.
Absolutely.
Yeah.
I try to help as many people as I can, but I got to tell you, when you get 50 DMs a day of big walls of text and comments on 1,000 different videos at once, literally 1,000, it's really hard to answer everyone. So that's the best way to get me for real, is to go to link in my bio. Those are the ones I take as more serious inquiries.
Gotcha. Yeah, I feel your frustration. You have a lot more followers on TikTok than I do. And
You have a lot more on YouTube than I do.
it's a struggle. It's a struggle to answer everybody, and I try to. It's a difficult thing, but I am going to link to
I want to
all.
help everyone.
Yeah, absolutely. That's why we're out there, to make a difference in people's lives, and you definitely are. I mean, like I said, your Epley maneuver video was the best I have ever seen. That's why I reached out to you.
Oh, wait. I have something to show you.
What?
My headband.
I love it.
This is the headband in the Epley video he was talking about.
I actually may put that in the thumbnail to the video.
Perfect.
That is phenomenal. Amy, this has been great. You answered all of my questions and gave me some insights and things I didn't know I had questions about. So that's phenomenal.
I very much thank you for having me on, Joe. I really appreciate it, and I love your channel as well. I've been thumbing through it, and you've got some great stuff in there.
I appreciate that. Thank you very much. I know this is making a difference in the lives of everybody who's listening and watching us.
I really appreciate you, and thanks for asking all the right questions too.
It helps when you have experience with the problem.
I kept just going, I'm so glad you said that. All right. Well, thank you so much, Joe. I hope you have a great day. I think I'm going to go out and play in the snow here in Baton Rouge, which is something I never thought I'd say.
I say enjoy it while you can.
All right. Bye, Joe.